Hi, I'm Asaf, a neuroscience PhD and PrediMed CEO. I've teamed up with healthcare professionals to create PrediMed, a platform designed to eliminate the use of unnecessary anesthesia in pediatric MRI scans. We're addressing a pervasive issue. Annually, over 6 million children in the EU and US undergo sedated MRI scans. Apart from the negative psychological effects, the financial burden is also substantial. Anesthesia alone can cost more than $3,000 per scan, and when you consider other associated costs, the total expenditure can reach more than $10.5 billion annually.
Current strategies have tried to mitigate the use of anesthesia, but they haven't been effective due to a one-size-fits-all approach that does not work. Children are not miniature adults, their cognitive and emotional faculties are still in development. Therefore, at PrediMed, we developed a patient-centric approach. We gather multifaceted data on each patient, ranging from demographics to cognitive assessments, to make informed predictions about their specific needs during the MRI scan.
Building on Yael's points, our platform engages all stakeholders at each stage of the MRI cycle. Prior to the scan, we analyze the data to determine if the child can undergo the procedure without anesthesia. During the scan, we deploy both existing clinical resources and our tailor-made digital content to increase the likelihood of a successful anesthesia-free scan. We also have a feedback mechanism post-scan to continually refine our predictive models.
Pilot studies have been initiated, including an observational study at Rambam Medical Center. We're in the first stages of interventional clinical trials and have already secured preliminary partnerships and funding, including a written letter of intent from Stanford's Lucille Packard Children's Hospital.
We're not stopping at MRI scans. This technology has the potential for broader applications in healthcare, allowing for better allocation of resources and a more personalized patient experience. To bring this vision to fruition, we are in the process of securing additional funding. Our business model is to offer subscription licenses to healthcare providers based on their patient volume or number of MRI machines.
My work includes constant interactions with pediatric patients and their families. The problem of unnecessary sedation is real. It adds clinical complexity, requires special magnetic slots and prolong the waiting time for the exam, and add additional source of anxiety for the already worried parents and patients. Human interactions with patients is and will always remain the most important aspect of healthcare. Also, to evaluate the actual need of performing the exam under anesthesia. However, in many cases, the MRI clinical staff does not have the resources nor the time to study the needs and personality of their patients in order to evaluate and to improve both the performances and patient experience. PrediMed offers an innovative method to help us better understand the patients and provide them with a personalized and empowered medical process. I strongly believe that by using PrediMed approach, the clinic and the patients will greatly benefit.
Join us to eliminate the use of anesthesia in children undergoing MRI scans.